Medicare for all is a national security issue as well as a, just decent human being issue. Check it out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel. Back, Thom Hartmann here with you. And, I wanted to talk about the coronavirus and the need for a national health care system. And we'll also get into the economy and pretty much, anything else you want to talk about today. There's a lot going on in the news. Pete Buttigieg has pulled out of the race. And, the speculation that I'm seeing is that he's going to endorse Joe Biden, presumably on the idea that who knows? But my personal guess would be, I'll endorse you, Joe Biden. You make me defense secretary. And I think Pete Buttigieg would actually make a very good defense secretary. But who knows? We'll see. But as the coronavirus is spreading around the world, we find ourselves, the United States finds ourselves as literally the only country in the world without a national health care system that can confront it. I mean, ever since Franklin Roosevelt first proposed a national single-payer health care system, actually it was Teddy Roosevelt who first proposed. He was a Republican. The first Democrat to propose it was Franklin Roosevelt. And then Harry Truman actually proposed it, tried to put it into law. And then, John Kennedy campaigned for this. We played the clip of that last week. And then LBJ started the process with Medicare and Medicaid. And Robert Ball, the guy who wrote the Medicare law, said explicitly, clearly, unambiguously, it's in my book, Rebooting the American Dream, the whole long thing about it, where Robert Ball said, we designed Medicare to be scalable. We were going to start with people over 65. And then, every year we could drop it by 10 years, down to 55, and then down to 45, and then 35. And over a period of a decade, we would have everybody in the country covered by Medicare. It was designed that way from the beginning. And Hubert Humphrey was talking about doing that, expanding Medicaid and Medicare, excuse me. But ever since then, ever since that start, well, actually, you can go all the way back to Social Security, Republicans have said no. They've said this is socialism. It's a terrible thing. They wanted to maintain the profits for their banksters who run the health insurance companies, instead of allowing Americans to have safety and security of knowing that they can go to the doctor without going broke. And the biggest danger that we face right now, in my humble opinion, with regard to the combination, this very toxic combination of having a for-profit healthcare system and having a disease out there that spreads like the common cold but has a 2% mortality rate, and we're not really sure the exact numbers and how it's going to play out in the developed world. We have Chinese numbers, but somewhere between a 5 and 15% hospitalization rate. The biggest danger we have right now is that those people who have the minimal symptoms, that 80% of people who get the coronavirus and don't even realize that they have the coronavirus, they just think they have a cold, that they're going to be spreading it to other people and it's going to become ubiquitous. It's entirely possible that what we are looking at here is simply a return to the old normal. When Franklin Roosevelt was a kid, he got polio. When my wife's grandmother was a kid, she got polio. Her left arm was, pretty unusable all her life. And Franklin Roosevelt couldn't walk. It just happened. There was no vaccine against polio. There was no cure for polio. Before that, it was tuberculosis. We had sanatoriums, but we had no drug to treat it. And so you could slow down the progression of the disease, but, people died from tuberculosis. When Edgar Allan Poe lived in New York City back in the mid-1800s, New York City was having a typhoid epidemic. And it was because their water system was contaminated by their sewer system. And, they thought it was bad air. It was the vapors, right? And so Edgar Allan Poe fled to upstate New York. I believe, I could be misremembering this because this is from high school days, but I believe that Lenore, the woman that he wrote the poem about, had died in that typhoid epidemic. But whatever it may be, this used to be how it was for the human race. If you got a bad scratch, 1% of the time it would become septic and you'd die. This is before antibiotics. If you got polio, well, you know, some people died from it. Most people were disabled by it. If you got tuberculosis, you got pulled out of the pot. You know, the only thing we had for that was isolation. You got put in a sanatorium. And the poor people suffered far more than the wealthy people. And back in the 1880s, under these kind of circumstances, the government of Germany decided, you know, we really need to have a national health care system. And the first single-payer national health care system was put into place in the 1880s in Germany. And it's now spread all over the world, except here in the United States. So to go back to this, I mean, if this ends up being like the common cold, that is seasonal, and, you know, yes, I know Trump said it's going to go away in the summer. Well, actually, he might be right. This is, you know, coronaviruses tend to peak during the winter and diminish during the summer, the common cold being the most common one. And there's dozens of varieties of coronaviruses that are the common cold. They're the corona A category of viruses. But if this becomes the new normal, and in particular, if it turns out that there are a couple of antiviral drugs and that actually can prevent people from dying from this coronavirus disease, and they're doing these tests with these things. I have a printout. Yeah, here it is, right here. The first case. This was published in the New England Journal of Medicine. This is this piece that I was telling you my daughter, the nurse practitioner, shared with me over the weekend. It's titled "First Case of 2019 Novel Coronavirus in the United States," and they document how this person, this was up in the Seattle area, as I recall, and this was the first confirmed case in the United States. It started on January 19th, 2020. 35-year-old man presented at an urgent care clinic in Snohomish County, Washington, with a 4-day history of cough and fever. And you know, they go through the whole thing. He started to deteriorate, and they put him on, and he developed pneumonia. And so they put him on IV antibiotics to knock out the pneumonia. Plus they had him on 650 milligrams of acetaminophen every 4 hours, 600 milligrams of ibuprofen every 6 hours, 600 milligrams of guaifenesin, which is for his cough, and then they were giving him saline. This is 6 days into the hospitalization, and then his liver starts behaving weird, and you've got all these numbers, you know, the alk phos and whatnot, and everything starting to look bad, right? Because and I'm looking at the X-rays here. So what do? They finally gave him, and it was called compassionate care. I'm looking for the name of the drug here. They gave clinicians. Here we go. At a period consistent with the development of radiographic pneumonia in this patient, clinicians pursued compassionate use of an investigational antiviral therapy. Treatment with intravenous remdesivir, a novel nucleotide analog prodrug in development, was initiated on the evening of day 7. No adverse effects were observed in association with the infusion. The vancomycin, the antibiotics for his pneumonia, were discontinued that night. And on day 8, the patient's clinical condition improved. Supplemental oxygen was discontinued. His oxygen saturation values improved to 94 to 96% while he was breathing ambient air, which is normally breathing. And the lower lobe rails were no longer present. His appetite improved. He was asymptomatic outside of an intermittent dry cough and a runny nose, basically. And as of January 30th, 2020, the patient remains hospitalized, but he is afebrile. In other words, he's able to get around. His symptoms are resolved. He's just a little weak. So they're trying out some of these drugs, and frankly, I think this is the most likely outcome that we're going to have, is that, for the people who get seriously ill, we will develop antiviral drugs that will knock this out. We did it with AIDS. They have found that there are some antiviral drugs that are actually effective against Ebola. Now, Ebola is much more rigorous a disease, and these drugs are not anywhere near as effective as 100%. But The drugs are being developed. Whether or not a vaccine will work, vaccines, they've been trying to come up with vaccines for the common cold forever, and it doesn't seem to, it's been a real challenge. But basically, I think we're going to get to the point, probably within a year, where even if this becomes a persistent thing that comes back every year like the flu, we will be able to deal with it. But then the question is, are we going to deal with it the Republican way, which is rich people who can afford the $5,000 deductible and can go to the hospital are going to get the treatment, and poor people who can't are going to die, which is how it is right now with lots of diseases. I mean, you saw the study that Yale University did that was published in the British medical journal Lancet, where they said that a Medicare for All program in the United States would save 68,000 lives. Now, some of those, when you dig into the study, some of those lives were being saved by early diagnosis. People presenting with, a lump that is cancer when it's still isolated to the lump, before it's metastasized. So that was a good chunk of them. And I don't have the study in front of me. I don't have the exact numbers here, so I'm not going to just throw numbers out. But the other part of it was that, people are postponing care for things like pneumonia, respiratory infections. And then they end up getting sick and dying, without going to the hospital, or they get to the hospital and it's basically too late. Why? Because of money, because of this Republican healthcare system. So, I mentioned in the first hour this guy in Florida who had just come back from China, went to the hospital to get himself tested. It cost him over $3,000. It's like, wait a minute. I mean, the Republican efforts to maintain profits for the health insurance industry are literally putting us all at risk. And it's time to have Medicare for all. This is a national security issue, and particularly as we're facing the possibility that we're going to have recurrent seasonal infections of something that actually has the potential not just to make people really sick, but to kill people. Now, of course, the flu does that, as we know. We've all learned 35,000 people a year die from the flu. A lot of those are, people who are dying. Some of them are people who are really sick to begin with. Some of them, they're just not seeking care soon enough. Why? Because our healthcare system's all screwed up.
This is the Thom Hartmann Program.
It's time to say, healthcare should not be a profit center for banksters, as in health insurance companies. It should be the way we treat people.